We're very excited at Coastal Fertility to be now offering our patients a new ultrasonography system called Cycle Clarity. And this is a huge benefit to our patients who are undergoing IVF. It is an artificial intelligence system that video measures and monitors all of our follicles, which is beneficial for our patients in so many ways. With using it, however, I have become to depend on it more and more, and I do think that it has many, many benefits to us and to our patients. From a patient perspective, it is much quicker. So sometimes when we used to do ultrasound monitoring IVF scans the old-fashioned way, patients could be in there with a vaginal probe in their vagina for 15-20 minutes while each individual follicle was measured. Now with the video, it's a very quick video sweep, so they're only having to sit there with a vaginal ultrasound being performed for maybe 30 seconds to a minute. So it is a much quicker, more comfortable exam for them. From a medical standpoint for physicians, I do think that the measurements are very accurate. We have been comparing them to our own kind of old-fashioned measurements. They are extremely accurate, and I find myself often looking at the videos. They're wonderful videos. You feel like when you are watching the video, you are doing the ultrasound yourself. You are visualizing this ovary in real time. You are seeing all of the follicles. You are seeing all of the follicle measurements. So I would usually have to trust, in the old days, the ultrasonographer's measurements, but was not able to see the ovary in real time. Now I'm actually able to see the ovary in real time and decide, do I think that those measurements are accurate? And that is a very wonderful tool to help me make my decisions. The other thing I do find myself using is there is a probability or a predictor tool that basically will tell you, based on the follicle size, when Cycle Clarity thinks that we should trigger the patient for retrieval to optimize the amount of eggs that we're going to get. And so how I've been using that is I do look at the size and kind of make my own clinical decision making on when I think that that timing is appropriate. But now I'm finding myself more looking at the Cycle Clarity predictor to kind of see, does it match with what I want to do? Or if I'm on the fence, do I trigger this patient today? Does she need one more day? That often is helping me make my decisions. Cycle Clarity has been fairly easy to implement. We have found that our medical assistants, our ultrasonographers, anybody who is performing the ultrasounds has been able to pick it up very quickly. From a physician standpoint, it's extremely easy to use. The portal that you utilize to look at the videos, to see the predictor tools, to see the measurements is a very well done portal, well done module where I can visualize everything about that patient on one screen. I can see their video, their follicle measurements, their predictor tools, and just with a quick glance, I can make my decisions on how I want that IVF cycle to proceed. We do use a fertility-based medical record system, and it has interfaced very well so that the measurements come straight over to our stimulation grids. We're able to visualize those with our EMR, and we are also able to see those on the Cycle Clarity portal as well. I will say that when we started talking about using Cycle Clarity, I was a little bit resistant, as I think probably most reproductive endocrinologists probably would be, and that is because we are so trained through all of our training to do ultrasounds ourselves, to take measurements ourselves, to visualize the ovaries ourselves. So there's a little bit of a difficulty in kind of relinquishing that control to an artificial intelligence system. I'm finding myself more and more really depending on those video images. I like to see my patient's ovaries and I like to see their follicle measurements, and I'm depending on those predictive tools, not necessarily to make the decision for me, but to help me feel good that I'm making the right decision or help me in those kind of borderline cases. So I think if that was taken away, it would be a little bit hard to go back to the old way. I think this is a huge benefit to patients. One, it really does minimize their appointment times and minimize their time that they're actually having ultrasounds performed, which can be a very time-consuming and not always comfortable procedure. So that's a huge benefit to patients. And the other benefit to them is we're really going to be getting extremely accurate measurements of the follicles. They're going to be artificial intelligence-based measurements versus human measurements, which are just by nature more accurate, and that's going to ultimately help them to get the best IVF cycle they can, to get the most eggs and embryos possible and optimize their outcomes.